or Kaizen with QC story. So after you have categorized the small Kaizen or the quick Kaizen or the short Kaizen is what you are able to work on immediately. So you work on it within a day, 2 or 3. Then for the large Kaizen is what you are going to subject to matrix diagram. The one that now follows the Kaizen process from step 1 to step 7. And now you do what? For number 1, you are going first of all to subject to matrix diagram so that you can pick on the most scoring theme. After you have gotten your highest scoring theme, the highest scored theme, now you do what? You come up with problem statement. The one that has scored the highest, that's what you are going to generate problem statement from it. Your highest scoring theme is now what you are going to make problem statement from it. So, in summary, if you want to know whether you are on right track for step 1 or whether you have done the right thing for step 1, first of all, you have to check whether you have selected the thing which can be solved within your section. Is this something that you are able to work on? We say there are those things that you are not supposed to pick because they are beyond your control. So whatever you have picked to work on, is it something that you as a facility or you as a department is able or you are able to work on? That is number 1 point. Because if it's not something that you can work on, so you are not going to go far. You will reach a point you will have to abandon that because it's beyond you. You cannot actually move. You will stuck. What will be the outcome or the result? You will abandon the project. Then step number 2, check whether the Kaizen theme was selected with matrix diagram. Whether you have actually selected with matrix diagram. You cannot say you have low skill delivery and maybe you have a low ACF, long waiting time for patients, and you have not shown us your matrix diagram. So it has to appear in your process of the Kaizen that this is what I had for my problems or my identified gaps. Now this is how I selected them to matrix diagram with the scores showing us what has scored the highest. Then check whether scale of feasibility is clarified or not. Actually, do you understand what is 3 and what is 1? Like I said, people confuse resources for 1 being you don't need resources. And 3, you need so much resources. So do you actually understand what 3 means and what 1 means? So that you pick the right theme. Then is the theme written in a positive manner? We said whatever is low, whatever is poor, whatever is long, whatever is negative, now change it into positive. Improve if it is low. Reduce if it's an reducing indicator. Maybe you want to reduce long waiting time for patients because patients complain about long waiting time in your facility. So you want to reduce long waiting time for patients. So have you written it in a positive manner? Something that you wish to work on so that you can meet your client's need. Then, is the problem statement clearly stated? This means, have you actually answered all the 5 W's? Have you answered, like, what is the problem? Where is it occurring? Who is causing the problem? So your problem statement must answer the 5 W's. And before I forget, after you have come up with your problem statement, remember you're also supposed to come up with an aim statement. Aim statement, after you have gotten your problem statement that you want to work on your low skill delivery, you have also to come up with an aim statement. Aim statement is what is an explicit description of team's desired outcome, which are expressed in a measurable or a time-specific way. So you are telling us you want to work on this by this period to reach. For example, you can say your aim is to move from 20, well, this is your desired outcome. You want to move from 20 as your number of skill delivery to 80 by June. Maybe you started this project in January. We said minimum is 6 months. So you can say to increase skill delivery in facility X from 20 to 80 by end of June or by June 2024. And I think I'm done. Thank you so much for listening to me. Unless there's anybody with questions.
Wow, wow. Thank you so much, Madam Nasibo, for that elaborate and wonderful presentation. I know it was insightful to majority of us. I know we will not leave the way we came. That was so much. A round of applause to you, Madam. That was excellently done. I've been able to capture a few questions because of time. I will direct them to you, and then you can just answer to the participants before we give our closing remarks. The first question that was asked is what the difference between a work improvement team and a quality improvement team? What is the difference between the work improvement team and the quality improvement team? The second question that was asked was the difference between step 2 and step 3. I'm not very sure if that one is to be covered today or during the next session. And then the third question that has come is scoring of the matrix diagram done individually or it's done as a team? I think to you, Nasibo, you can answer those first three questions.
Okay, thank you so much, participants, and thank you, Rosie, for that. So the difference between WIT and KIT, that is WIT Work Improvement Team and QIT. So WIT is, I said, people who share the same, their work is similar. Actually, you work in the same department, you work in the same section or in the same unit. I was giving an example like people working in MCH with MCH is comprises of what and what. So you actually work together. Your work is similar. You have a common goal. Maybe people who work in lab departments. So you are actually working in lab and your work is similar. You have an objective. You have a common goal. People working in maybe CCC clinic. So these are people who work together who have common goal. But for the QIT, this is for the facility. This is quality improvement team. And QIT is generated from the WIT. So QIT makes up the departmental heads. For QIT, we'll have the facility in charge, maybe the head of lab department, the head of MCH, the head of CCC, all the department that you have in that particular facility is what makes up the QIT. The departmental heads within that facility, including the facility in charge or the MERSUP or the one who is managing the facility. These are the people now who make the QIT. And at times they are supposed to supervise what is happening in the WIT. And each WIT has a member of QIT in WIT. Like for instance, the TB WIT, one of the person in WIT, the TB WIT is a member to the QIT, the quality improvement of the facility. The person in CCC WIT is a member to the QIT. So QIT makes up the heads of department of each department within that facility. I hope I've answered you. Then for step 2 and 3, I think this will not be the right forum. Maybe from this, maybe in the next webinar, we can discuss step 2 because it's actually a whole session about step 2. So I might confuse you now when I start discussing about step 2 and 3 because of even time. I might not be in a position to differentiate between the two. But maybe in brief or in summary, in step 2 is contributing factors and step 3 are the root causes of your issues. Contributing factors means what makes you say that you have an issue. What makes you say that? A good example is like maybe you say you have incomplete documentation in maternity files. Why are you saying you have incomplete documentation in maternity files? What makes up the maternity files? Maternity files has cardex, has photograph, has a history taking part, has all those things. So those are the things that make up the maternity files. They are the contributors to maternity files. If now you say you have incomplete documentation in maternity files, you are supposed to look at these parameters. Is it the photogram? Is it the cardex? Is it the history taking that is incompletely done? So these are what are your contributors to your incomplete documentation in maternity files. But when it comes to the root causes, now you want to understand why is maybe the pathogram not filled well? Why is maybe the biodata not there? Now these are the reasons as to why you have the gaps. That is what I can say for today. Maybe we can have this discussion in the next webinar in future. Then scoring. I don't understand. I've not got any well about scoring, Rosie. You said scoring?
Is scoring of the matrix diagram done individually or it's done as a team?
It's done as a team. It's done as a team. What you do individually is just brainstorming. It's just coming up with the issues that you think affects your service delivery in your particular department or in your facility. Brainstorming is what you don't discuss. But when it comes to score, because we want to look at, you can ask yourselves among yourself, you can ask a question like, we want to do this within maybe 6 months, because that is possibility. Is it possible? Can we be able to do it within 6 months? It's not something that you can ask yourself because it's teamwork. So you are not going to work alone. You are asking the rest of you are discussing. Is this something that you are able to do within 6 months? Wengine watasema no, yes. So you debate, you discuss, then you come to consensus. So for scoring, it's discussion.
All right. Maybe the last set, Maybe the last set of questions, I can see people comment positively about the presentation. People are happy and they have really enjoyed the presentation. But maybe we can have these last questions. The first one is, what can happen if the problem is not clearly stated? What can happen if the Sorry for that. Sorry, I was muted by the host. Sorry. What can happen if the problem is not clearly stated? And then the other question someone is asking, we enjoy our comfort zones. How can we proactively identify possible gaps? And majority of members have echoed that attitude and behavior change is the main challenge when it comes to CQI. So members should really work on their attitude and change of behaviors for us to have successful CQI. So maybe for 2 questions as we almost ending up.
I actually want to echo the last point that we have just said, because this is the challenge that we have been having in our various facilities, because QI is left to maybe the focal person or to one person in facility. People look at QI as something new, something an added job, something that is burden, it's maybe additional work. And that is wrong, because QI is not something new, it's not additional work. It's actually doing whatever you're doing in a smart way. For you to improve on a skill delivery, it's not something from outside that is outside your scope of work. You actually want to work, you need to have that job satisfaction that you are working in a particular facility and your deliveries are low. So you should actually be worried. You should be asking yourself, why are we not having deliveries more like any other facility? What are we not doing right? So these are the questions that you need to ask yourself, and maybe by asking yourself and finding solutions to it so this is what CQI all about. It's not something from outside. So that is one thing people should understand, and maybe embrace CQI as it's my own work. It's just what I do. I want to do it smart. I want to do it to improve on it, to meet my client's need, because at the end of the day, it's your job satisfaction. When you do things and people appreciate, you are not where you were yesterday, there is always an improvement. There is always something good about whatever you are doing. Basically, good for everyone. So people should look at it as improving your own work. We said Kaizen target is your work, not other people's work. And then about what can happen if you have not done your problem statement, you have not done it well. Yes, because the 5 Ws is actually like a guide. What is your issue? So you see, you cannot work on something that you don't even know. You see, we said, when is it occurring? Because you are supposed to see. You are saying you have lost something, or you are not doing well in a particular area. Why are you saying that? Because for you to actually work on a particular gap, you are supposed to tell us you are at point A and not point C. So it's telling you what makes you say you have an issue. It's because based on your data, based on your baseline data, you are not where you are supposed to be. So if you have not done it well,